A patient with myocardial infarction is given intravenous milrinone. Which other intravenous medication in the patient's medication prescriptions would the nurse question? 1. Digoxin 2, lisinopril 3, carvedilol 4, furosemide. Answer: 4. Furosemide. Rationale: furosemide is a diuretic drug that is prescribed to reduce edema. When taken intravenously, furosemide reacts with milrinone and precipitates it, thereby reducing its therapeutic effect. Therefore, it is not usually prescribed in an intravenous formulation. Digoxin does not cause any adverse reaction with milrinone, so they can be administered together. Lisinopril is an angiotensin-converting enzyme that is prescribed for myocardial infarction. It does not cause any interaction with milrinone. Carvedilol is a nonspecific beta blocker prescribed for myocardial infarction. It does not cause any reaction with milrinone. Which condition is a contraindication to safe administration of milrinone? 1. Diabetes 2. Skin disease 3. Ear infection 4. Hypokalemia. Answer: 4. Hypokalemia. Rationale: milrinone is a phosphodiesterase inhibitor. Because milrinone decreases serum potassium concentration, the nurse would check the patient's history for hypokalemia. Administration of milrinone to a patient who has hypokalemia may lead to severe complications. Milrinone can be safely administered to patients with diabetes, skin diseases, or ear infections because it does not cause any complications when a patient has these health conditions. A patient is taking 0.25 milligrams of digoxin and 40 milligrams of furosemide daily. When the nurse enters the room, the patient reports seeing yellow halos around the lights. Which action would the nurse take first? 1. Withhold the next dose of furosemide. 2. Administer the medication as prescribed. 3. Document the findings and reassess in 1 hour. 4. Assess the patient for symptoms of digoxin toxicity. Answer: 4. Assess the patient for symptoms of digoxin toxicity. Rationale: a change in vision, such as a yellow halo surrounding the peripheral field, may be reported by patients experiencing digoxin toxicity. In this case, the first action the nurse would take is to further assess the patient for additional signs of digoxin toxicity. Furosemide is a potassium-wasting loop diuretic. When furosemide is taken together with digoxin, the patient is at increased risk for digoxin toxicity if the serum potassium levels are low. The nurse would not withhold the next dose of furosemide without first assessing the patient and contacting the healthcare provider, but would have to be aware of this drug interaction. The nurse would not administer medication as prescribed because the patient has a change in status that may be related to the medications. The nurse would first fully assess the patient. Documentation and reassessment are a part of the nurse's responsibility, but because the patient has a reported change in status and is at risk for digoxin toxicity, it would not be acceptable for the nurse to wait to take further action. Assessment must be done to determine the source of the patient's reported visual symptomology. A patient with heart failure taking digoxin reports nausea, vomiting, and visual changes. Which does the nurse include in the plan of care? 1. Obtain digoxin level. 2. Lower the digoxin dose. 3. Discontinue medication. 4. Initiate telemetry monitoring. Answer: 1. Obtain digoxin level. Rationale: the patient is exhibiting signs of digoxin toxicity, so the nurse would plan to obtain a digoxin level. The nurse may hold the dose until the laboratory results are available, but the nurse would never lower the dose or discontinue a medication without consulting the healthcare provider. The patient receiving digoxin does not need telemetry monitoring. A patient who is taking digoxin for heart failure has severe vomiting. The spouse prepares ginseng tea for the patient to relieve vomiting. Which symptom may occur as a result of this nursing action? 1. Tachycardia. 2. Bradycardia. 3. Hypertension. 4. Hypermagnesemia. Answer. 2. Bradycardia. Rationale. Digoxin increases the force of the contractions in the heart and consequently decreases the heart rate. Ginseng increases the serum concentrations of digoxin. Ginseng tea would relieve vomiting but would also rapidly decrease the patient's heart rate. Digoxin toxicity causes bradycardia but not tachycardia. Digoxin, an indirect vasodilator, does not cause hypertension. Increased serum concentrations of digoxin resulting from taking ginseng tea does not cause hypermagnesemia. The nurse is caring for a patient after a myocardial infarction. The nurse finds that the patient's heart rate has increased to 130 beats per minute and the patient's weight has increased by 8.8 pounds, 4 kilograms, overnight. Which intravenous combination of drugs will the primary healthcare provider prescribe to the patient in this condition? 1. Carvedilol and nasiratide. 2. Lisinopril and furosemide. 3. Milrinone and furosemide. 4. Lisinopril and spironolactone. Answer. 2. Lisinopril and furosemide. Rationale. The patient has a myocardial infarction, and an increased heart rate indicates that the patient is at risk for cardiac arrest. An overnight increase in weight is caused by edema, and thus a diuretic would be prescribed for the patient. Lisinopril is prescribed for heart failure, and furosemide is a diuretic prescribed for edema. Lisinopril and furosemide do not interact and are safe to be administered in combination. Carvedilol is a non-selective beta blocker administered for myocardial infarction, and nasiratide is a natriuretic peptide. Natriuretic peptides would be administered only when heart failure worsens, and they cannot replace diuretics. Milrinone precipitates furosemide when administered intravenously, and the therapeutic effect of the drug does not occur, hence, this combination is not administered. Spironolactone is a potassium-sparing diuretic that may cause complications when administered with lisinopril because lisinopril causes hyperkalemia. The nurse administers prescribed furosemide and milrinone simultaneously through the same intravenous line. This nursing action will result in which consequence seen in the patient? 1. Toxic effects of milrinone. 2. Toxic effects of furosemide. 3. No therapeutic effects of milrinone. 4. No therapeutic effects of furosemide. Answer. 4. No therapeutic effects of furosemide. Rationale. When furosemide is administered simultaneously with milrinone through the same intravenous line, furosemide is precipitated. So, the therapeutic actions of furosemide are not seen. Furosemide does not increase the serum concentrations of milrinone, so toxic effects of milrinone will not be seen in the patient. Furosemide is precipitated while being administered, thereby making it unavailable to influence therapeutically. Milrinone would produce its therapeutic actions because it is not precipitated. A patient with heart failure and hypothyroidism is prescribed digoxin. Which nursing intervention will prevent digoxin toxicity? 1. Calculate the digoxin dose with correct decimal placement. 2. Administer a higher than usual dose of digoxin to the patient. 3. Administer digoxin immune fab before administering digoxin. 4. Prevent the consumption of large amounts of bran with digoxin. Answer. 1. Calculate the digoxin dose with correct decimal placement. Rationale. Digoxin doses can be lethal if calculated with incorrect decimal placement. Trailing zeros are not to be used after decimal points. This can lead to misinterpretation of the dose calculation. For example, 1.0 can be read as 10. Leading zeros must be used if a dose is less than a whole number to prevent digoxin toxicity, for example, 0.25 instead of 0.25. Digoxin must be administered in lower doses to patients with hypothyroidism because it delays renal excretion of the drug. Consequently, administration of digoxin in higher or normal doses to patients with hypothyroidism may lead to digoxin toxicity. Digoxin immune Fab is only administered if the patient has high serum concentrations of digoxin. Therefore, the serum concentrations of digoxin would be checked before administration of digoxin immune Fab. High intake of fiber through foods such as bran binds to digoxin and leads to a decrease in the absorption of the drug. Therefore, it does not cause digoxin toxicity. A patient's serum digoxin level is noted to be 0.4 nanograms per milliliter. Which action would the nurse take? 1. Administer potassium. 2. Hold future digoxin doses. 3. Call the healthcare provider. 4. Administer the prescribed dose of digoxin. Answer. 4. Administer the prescribed dose of digoxin. Rationale. Therapeutic serum digoxin levels are 0.5 to 2 nanograms per milliliter. The patient would receive the next dose to bring the level into therapeutic range. Potassium would never be given without documented potassium deficiency. Because the dose is in the subtherapeutic range, it is not necessary to hold future doses. The level is slightly subtherapeutic, so notifying the healthcare provider is not the priority action. A patient is undergoing standard heart failure therapy that does not include a diuretic. The patient's weight has increased by 2 pounds, 0.9 kilograms, since yesterday. Which action does the nurse implement first? 1. Explaining how to read food labels. 2. Telling the patient to reduce the daily sodium intake. 3. Instructing the patient to seek emergency care. 4. Asking the patient about the food eaten in the past 24 hours. Answer. 4. Asking the patient about the food eaten in the past 24 hours. Rationale. An overnight weight gain of 2 pounds, 0.9 kilograms, implies that the patient has been non-adherent to the therapy regimen in some manner. The patient has missed some medication. Eaten foods containing high levels of sodium or measured weight differently. Before planning the care, the nurse must complete the patient assessment, which includes asking the patient about the diet the patient was eating in the past 24 hours. The care implemented by the nurse depends on the patient's response. Reduction of sodium consumption is an effective method of controlling total body fluid. Sodium is a component of many foods and is found in all processed foods. So teaching the patient how to read food labels and telling the patient to reduce daily sodium intake could be effective, but these are not the first actions to implement. Emergency treatment is not necessary, but the fluid accumulation must be resolved to prevent exacerbation of the heart failure. The nurse who is caring for a patient with a myocardial infarction informs the patient, "This drug will increase the contractions of your heart." Which drug has been prescribed to the patient? 1. Digoxin. 2. Carvedilol. 3. Verapamil. 4. Metoprolol. Answer. 1. Digoxin. Rationale. Digoxin is a cardiac glycoside that acts as a positive inotropic drug by increasing myocardial contractility. Carvedilol is a beta blocker that acts as a negative inotropic drug that reduces the force of contractions. Verapamil is a calcium channel blocker that is a negative inotropic drug. Metoprolol is a beta blocker that reduces myocardial contractility and thus is a negative inotropic drug. The nurse suspects that an 80-year-old patient is developing digoxin toxicity. For which symptoms will the nurse monitor? Select all that apply. 1. Anorexia. 2. Vomiting. 3. Dry cough. 4. Muscle twitching. 5. Visual disturbances. Answer. 1. Anorexia. 2. Vomiting. 4. Muscle twitching. 5. Visual disturbances. Rationale. The early symptoms of digoxin toxicity are anorexia, nausea, vomiting, and loss of appetite. The patient may also have visual disturbances such as halo vision. Hypomagnesia can precipitate digoxin toxicity. A symptom of hypomagnesia is muscle twitching. Dry cough is a common side effect associated with angiotensin-converting enzyme inhibitors rather than digoxin. While reviewing the medical record of a patient who is receiving digoxin therapy, the nurse notes that the patient has atrial tachycardia and impaired renal function. Arrange the order of the nursing interventions for this patient. 1. Administer digoxin immune fab as prescribed. 2. Administer potassium supplements as prescribed. 3. Monitor cardiac dysrhythmias by electrocardiograph. 4. Determine serum digoxin and electrolyte concentrations. 5. Discontinue administration of digoxin and notify the healthcare provider. Correct order. 5. Immediately discontinue digoxin and notify healthcare provider. 3. Monitor cardiac dysrhythmia by electrocardiograph. 4. Determine serum digoxin and electrolytes concentrations. 2. Administer potassium supplements as prescribed. 1. Administer digoxin immune fab as prescribed. Rationale. Atrial tachycardia indicates of digoxin toxicity, and impaired renal function may predispose patients to increased toxicity. The nurse would immediately discontinue administration of digoxin. Electrocardiograph monitoring would begin to check for cardiac dysrhythmias so an antidysrhythmic drug can be administered accordingly. Serum digoxin and electrolyte concentrations would be monitored to check whether there is an electrolyte imbalance, because digoxin toxicity reduces potassium and magnesium concentrations. Potassium supplements would be administered accordingly after checking the electrolyte balance. Digoxin immune fab is an antidote for digoxin, so it would be administered after monitoring cardiac dysrhythmia and electrolyte balance. Which medication is used to treat supraventricular dysrhythmia? 1. Digoxin. 2. Nasiratide. 3. Milrinone. 4. Verapamil. Answer. 1. Digoxin. Rationale. Digoxin is a cardiac glycoside used to treat supraventricular dysrhythmia. Nasiratide is used to treat acutely decompensated heart failure. Milrinone is used to treat heart failure. Verapamil is used to treat hypertension and angina. Which medication can interfere with absorption of digoxin? 1. Sucralfate. 2. Verapamil. 3. Amiodarone. 4. Cyclosporin. Answer. 1. Sucralfate. Rationale. Sucralfate decreases the absorption of digoxin. Verapamil, amiodarone, and cyclosporin interact with digoxin and decrease the clearance of digoxin. Therefore, co-administration of these drugs may result in increased concentration of digoxin in the body. A patient with heart failure is prescribed lisinopril. Arrange the order in which lisinopril acts. 1. Decreases the volume of blood. 2. Decreases the work of the heart. 3. Prevents sodium and water resorption. 4. Decreases the end diastolic volume. Correct order. 3. Prevents sodium and water resorption. 1. Decreases the volume of blood. 4. decreases the end diastolic volume. 2. Decreases the work of the heart rationale. Lisinopril inhibits angiotensin converting enzyme, which is responsible for converting angiotensin I to angiotensin II. Angiotensin II is a potent vasoconstrictor and induces aldosterone secretion. So, lisinopril inhibits aldosterone secretion and prevents sodium and water resorption. This results in a decrease in the circulating blood volume. As the circulating blood volume is reduced, the preload or end diastolic ventricular volume reduces. Consequently, the heart has to put forth less effort to pump blood. A parent reports that a child has been experiencing shortness of breath and chest pains. The nurse suspects that the child has heart failure, HF. Which signs may the nurse observe in the child that would support this suspicion? Select all that apply. 1. Bradycardia. 2. Poor growth. 3. Difficulty eating. 4. Hypomagnesemia. 5. Dyspnea with minimal exertion. Answer. 2. Poor growth. 3. Difficulty eating. 5. Dyspnea with minimal exertion. Rationale. Children with HF show poor growth because the heart takes up most of the energy for normal functioning. Also, they show poor eating habits because of difficulty eating and are easily tired because of the extra energy required for eating. The lungs of children with HF are filled with fluid, which makes it difficult to breathe even with minimal exertion activities such as walking. Children with HF do not show bradycardia. Instead, they have tachycardia to compensate for the improper working of the heart. HF does not affect concentrations of magnesium, thus, hypomagnesemia is not a sign of HF. The New York Heart Association's NYHA functional classification for cardiac disease classifies patients within Class 3 based on which limitations of physical activity. 1. No limitation of physical activity. 2. Slight limitation of physical activity. 3. Inability to perform physical activity. 4. Marked limitation of physical activity. Answer. 4. Marked limitation of physical activity. Rationale. Patients with cardiac disease who have a marked limitation in physical activity are classified as Class 3 according to the NYHA's functional classification for cardiac disease. They are comfortable at rest. Activities requiring minimal effort in such patients would cause fatigue, palpitation, dyspnea, or anginal pain. Patients with cardiac disease who have no limitation of physical activity are classified under Class 1 of the NYHA's functional classification. Patients with cardiac disease who are comfortable at rest but in whom ordinary physical activities result in fatigue, palpitation, difficulty breathing, or anginal pain belong to Class 2 of the NYHA's functional classification. Patients with cardiac disease resulting in an inability to perform any physical activity without discomfort are classified in Class 4 of the NYHA's functional classification. Symptoms of heart failure or anginal syndrome may be present even at rest. For a patient receiving a positive inotropic drug, which nursing assessments should be performed? Select all that apply. A. Obtain daily weights. B. Check apical pulse. C. Auscultate lung sounds. D. Review red blood cell count. E. Monitor serum electrolytes. Answer. A. Obtain daily weights. B. Check apical pulse. C. Auscultate lung sounds. E. Monitor serum electrolytes. When teaching a patient regarding the administration of digoxin, lanoxin, the nurse instructs the patient not to take this medication with which food? A. Scrambled eggs. B. French toast. C. Wheat bran. D. Bananas. Answer. C. Wheat bran rationale. Encourage patients to avoid using antacids or eating ice cream, milk products, yogurt, cheese, dairy products, or bran for 2 hours before or 2 hours after taking medication to avoid interference with the drug's absorption. The nurse would question the use of milrinone, Primacor, in a patient with which condition? A. Mitral valve prolapse. B. Aortic regurgitation. C. Systolic heart failure. D. Acute renal failure. Answer. B. Aortic regurgitation rationale. Milrinone, Primacor, a PDI, is contraindicated in severe aortic or pulmonary valvular disease and in diastolic heart failure. The nurse reviews an adult patient's laboratory values and notes a digoxin level of 11 nanograms per milliliter and a serum potassium level of 6.2 meq/L. The nurse would notify the healthcare provider and anticipate which medication will be prescribed to administer. A. Atropine. B. Digoxin immune fab. C. Sodium polystyrene sulfonate, Kxalate. D. Epinephrine, adrenaline. Answer. B. Digoxin immune fab. Which of the following would lead to an increase in cardiac output? 1. Reduced cardiac contractility. 2. Hypovolemia. 3. Peripheral vascular resistance. 4. Increase in preload. Correct answer. 4. Increase in preload rationale. Increased preload results in a more forceful contraction and increases cardiac output. Hypovolemia is a lower blood volume and will result in lower cardiac output. Peripheral vascular resistance increases afterload and increases the workload on the heart. A reduction in cardiac contractility results in lower preload and subsequent cardiac output. Which statement is accurate regarding the physiological changes associated with heart failure? 1. Blood backs up into the lungs due to right ventricular hypertrophy. 2. The walls of the heart shrink, leading to lower cardiac output. 3. Cardiac remodeling occurs after prolonged ventricular hypertrophy. 4. Blood pressure increases, resulting in lowered afterload. Correct answer. 3. Cardiac remodeling occurs after prolonged ventricular hypertrophy. Rationale. Heart walls thicken and enlarge with heart failure. These changes occur over time and are referred to as cardiac remodeling. Blood can back up into the lungs, but this would be a result of left ventricular hypertrophy, not right. Blood pressure can go up, but would result in a higher, not lower, afterload. The patient has a history of cardiac disease and receives digoxin, lanoxin. The nurse determines that education about dietary needs with this medication has been effective when the patient makes which selection for lunch? 1. Cottage cheese, peach salad, and blueberry pie. 2. Baked fish, sweet potatoes, and banana pudding. 3. Green bean soup, whole wheat bread, and an apple. 4. Hamburger, French fries, and chocolate chip cookies. Correct answer. 2. Baked fish, sweet potatoes, and banana pudding. Rationale. Fish, sweet potatoes, and bananas are high in potassium, which will help prevent digoxin toxicity. The hamburger is high in potassium, but the French fries are not appropriate for a cardiac patient. Green bean soup, whole wheat bread, and an apple are not significant sources of potassium needed to help prevent digoxin toxicity. Cottage cheese, peach salad, and blueberry pie are not significant sources of potassium needed to help prevent digoxin toxicity. The patient has heart failure and receives digoxin, lanoxin. Prior to discharge, what will the best teaching plan by the nurse include? 1. Report a weight gain of 2 or more pounds per day. 2. Report mental changes such as euphoria. 3. Stop the medication if your pulse is 56. 4. If you miss a dose, take 2 doses. Correct answer. 1. Report a weight gain of 2 or more pounds per day. Rationale. Weight gain could indicate fluid retention and a worsening of heart failure. Patients should not take a double dose. This is considered an overdose that could lead to toxicity. If the pulse is 56, the patient should notify the physician and not stop the medication unless direct to do so. Mental depression is more likely to occur than euphoria. The patient takes insulin for diabetes mellitus. The physician orders metoprolol, Lopressor, for hypertension. After medication teaching, the nurse determines that learning has occurred when the patient makes which statement. 1. I might not need to check my blood sugars as often with metoprolol, Lopressor. 2. I might be able to change from insulin to a pill with metoprolol, Lopressor. 3. I might need less insulin when I take metoprolol, Lopressor. 4. I might need more insulin when I take metoprolol, Lopressor. Correct answer. 3. I might need less insulin when I take metoprolol, Lopressor. Rationale 1. Metoprolol, Lopressor, may enhance the hypoglycemic effects of insulin and oral hypoglycemic agents. So the patient might require less insulin. Metoprolol, Lopressor, will not change a diabetic patient's need for insulin. The patient might just require less insulin. The patient will most likely need more frequent blood glucose assessments, as metoprolol, Lopressor, may enhance the hypoglycemic effects of insulin. Phosphodiesterase inhibitors, PDIs, have an added advantage in treating heart failure. These drugs cause a positive inotropic effect, and what other effect? A. Platelet inhibition. B. Vasoconstriction. C. Vasodilation. D. Bronchodilation. Answer. C. Vasodilation. Rationale. PDIs are also called anodilators because they have both positive inotropic and vasodilatory effects. A patient with heart failure will be starting the beta blocker metoprolol, Lopressor. The nurse will monitor for which expected cardiovascular effects. Select all that apply. A. Increased heart rate. B. Increased myocardial contractility. C. Delayed AV node conduction. D. Reduced heart rate. E. Decreased myocardial automaticity. Answer. C. Delayed AV node conduction. D. Reduced heart rate. E. Decreased myocardial automaticity. The nurse is administering an intravenous infusion of a phosphodiesterase inhibitor to a patient who has heart failure. The nurse will evaluate the patient for which therapeutic effects. Select all that apply. A. Positive inotropic effects. B. Vasodilation. C. Decreased heart rate. D. Increased blood pressure. E. Positive chronotropic effects. Answer. A. Positive inotropic effects. B. Vasodilation. E. Positive chronotropic effects, which are therapeutic effects of digoxin, lanoxin. A. Positive inotropic, negative chronotropic, and negative dromotropic. B. Negative inotropic, negative chronotropic, and negative dromotropic. C. Positive inotropic, positive chronotropic, and negative dromotropic. D. Positive inotropic, negative chronotropic, and positive dromotropic. Answer. A. Positive inotropic, negative chronotropic, and negative dromotropic. Rationale. Digoxin increases cardiac contractility, positive inotropic effect. Decreases heart rate, negative chronotropic effect, and decreases conductivity, negative dromotropic effect. A patient is taking a beta blocker as part of the treatment plan for heart failure. The nurse knows that the purpose of the beta blocker for this patient is to A. Increase urine output, B. Prevent stimulation of the heart by catecholamines, C. Increase the contractility of the heart muscle, D. Cause peripheral vasodilation. Answer: B. Prevent stimulation of the heart by catecholamines. When monitoring a patient who is receiving an intravenous infusion of nasiratide, Natracor, the nurse will look for which adverse effect: A. Dysrhythmia, B. Proteinuria, C. Hyperglycemia, D. Hypertension. Answer: A. Dysrhythmia. When teaching the patient about the signs and symptoms of cardiac glycoside toxicity, the nurse should alert the patient to watch for A. Visual changes such as photophobia, B. Flickering lights or halos around lights, C. Dizziness when standing up, D. Increased urine output. Answer: B. Flickering lights or halos around lights. A patient with decompensated heart failure is given an intravenous infusion of a peptide drug. Which effect is produced by this treatment? 1. Decreased synthesis of angiotensin II. Blockade of angiotensin II receptors 3. Increased levels of cyclic AMP4. Increased levels of cyclic GMP5. Increase influx of calcium. Answer: 4. Increase levels of cyclic GMP. Several weeks after beginning treatment for severe heart failure, a man develops hyperkalemia requiring hospitalization. Which agent is most likely responsible for this adverse effect? 1. Milrinone 2. Digoxin 3. Furosemide 4. Dobutamine 5. Milrinone. Answer: 1. Milrinone. Beneficial effects of carvedilol in persons with heart failure are obtained with use of which drug administration regimen? 1. Intravenous infusion for 3 to 7 days. 2. Low doses that are gradually increased over time. 3. Loading doses followed by maintenance doses. 4. High doses that are gradually tapered over time. 5. Titration to obtain the desired increase in cardiac output. Answer: 2. Low doses that are gradually increased over time. Which drug classes are considered first-line treatment for heart failure? Select all that apply. A. Angiotensin-converting enzyme, ACE, inhibitors. B. Angiotensin II receptor blockers, ARBs. C. Digoxin, cardiac glycoside, D. Beta blockers. E. Nasiratide, Natracor, the B-type natriuretic peptide. Answer: A. Angiotensin-converting enzyme, ACE, inhibitors. B. Angiotensin II receptor blockers, ARBs. D. Beta blockers. Rationale: ACE inhibitors, ARBs, and beta blockers are now considered the first-line treatments for heart failure. Digoxin is used when the first-line treatments are not successful. Nasiratide is considered a last resort treatment when a patient is experiencing digoxin toxicity, which clinical situation would necessitate the use of digoxin immune fab, Digifab. Select all that apply. A. The patient reports seeing colorful halos around lights. B. The patient's serum potassium level is above 5 meq/L. C. The patient is experiencing nausea and anorexia. D. The patient is experiencing severe sinus bradycardia that does not respond to cardiac pacing. E. The patient has received an overdose of greater than 10 mg of digoxin. F. The patient reports fatigue and headaches. Answer: B. The patient's serum potassium level is above 5 meq/L. D. The patient is experiencing severe sinus bradycardia that does not respond to cardiac pacing. E. The patient has received an overdose of greater than 10 mg of digoxin. Rationale: clinical situations that would require the use of digoxin immune Fab in a patient with digoxin toxicity include serum potassium level above 5 meq/L, severe sinus bradycardia that does not respond to cardiac pacing, or an overdose of more than 10 mg of digoxin. Seeing colorful halos around lights and experiencing nausea, anorexia, fatigue, and headaches are potential adverse effects of digoxin therapy but are not necessarily reasons for digoxin immune Fab treatment. The patient is in the intensive care unit and receiving an infusion of milrinone, Primacor, for severe heart failure. The prescriber has written an order for an intravenous dose of furosemide, Lasix. How will the nurse give this drug? A. Infuse the drug into the same intravenous line as the milrinone. B. Stop the milrinone, flush the line, and then administer the furosemide. C. Administer the furosemide in a separate intravenous line. D. Notify the prescriber that the furosemide cannot be given at this time. Answer: C. Administer the furosemide in a separate intravenous line. Rationale: furosemide must not be injected into an intravenous line with milrinone because it will precipitate immediately. The infusion must not be stopped because of the patient's condition. A separate line will be needed. The other options are incorrect. Administering digoxin immune Fab, Digibind, to a patient with severe digoxin toxicity, the nurse knows that each vial can bind with how much digoxin. A. 0.5 mg. B. 5 mg circa 5.5 mg. D. 15 mg. Answer: A. 0.5 mg. Rationale: a 1 vial of digoxin immune Fab binds 0.5 mg of digoxin. The other options are incorrect. The nurse notes in a patient's medical record that nasiratide, Natracor, has been ordered. Based on this order, the nurse interprets that the patient has which disorder? A. Atrial fibrillation. B. Acutely decompensated heart failure with dyspnea at rest. C. Systolic heart failure. D. Long-term treatment of heart failure. Answer: B. Acutely decompensated heart failure with dyspnea at rest. Rationale: nasiratide is indicated for the treatment of acutely decompensated heart failure with dyspnea at rest. Digoxin is used for the treatment of atrial fibrillation and systolic heart failure. Long-term treatment of heart failure is not an indication for nasiratide. The nurse administering the phosphodiesterase inhibitor milrinone, Primacor, recognizes that this drug will have a positive inotropic effect. Which result reflects this effect? A. Increased heart rate. B. Increased blood vessel dilation. C. Increased force of cardiac contractions. D. Increased conduction of electrical impulses across the heart. Answer: C. Increased force of cardiac contractions. Rationale: positive inotropic drugs increase myocardial contractility, thus increasing the force of cardiac conduction. Positive chronotropic drugs increase the heart rate. Positive dromotropic drugs increase the conduction of electrical impulses across the heart. Blood vessel dilation is not effective in assessing a patient before administration of a cardiac glycoside. The nurse knows that which lab result can increase the toxicity of the drug. A. Potassium level 2.8 meq/L. B. Potassium level 4.9 MEq, LC. Sodium level 140 MEq, LD. Calcium level 10 mg per deciliter. Answer. A. Potassium level 2.8 MEq, L. Rationale. Hypokalemia increases the chance of digitalis toxicity. The other levels listed are incorrect. A patient has been placed on a milrinone, Primacor, infusion as part of the therapy for end-stage heart failure. What adverse effect of this drug will the nurse watch for when assessing this patient during the infusion? A. Hypertension. B. Hyperkalemia. C. Nausea and vomiting. D. Cardiac dysrhythmias. Answer. D. Cardiac dysrhythmias. Rationale. The primary adverse effects seen with milrinone are cardiac dysrhythmias, mainly ventricular. It may also cause hypotension, hypokalemia, and other effects, but not nausea and vomiting. A patient has been taking digoxin at home but took an accidental overdose and has developed toxicity. The patient has been admitted to the telemetry unit, where the physician has ordered digoxin immune fab, Digifab. The patient asks the nurse why the medication is ordered. What is the nurse's best response? A. It will increase your heart rate. B. This drug helps to lower your potassium levels. C. It helps to convert the irregular heart rhythm to a more normal rhythm. D. This drug is an antidote to digoxin and will help to lower the blood levels. Answer. D. This drug is an antidote to digoxin and will help to lower the blood levels. Rationale. Digoxin immune fab, Digifab, is the antidote for a severe digoxin overdose. It is given intravenously. The other options are incorrect. A patient about to receive a morning dose of digoxin has an apical pulse of 53 beats per minute. What will the nurse do next? A. Administer the dose. B. Administer the dose and notify the prescriber. C. Check the radial pulse for 1 full minute. D. Withhold the dose and notify the prescriber. Answer. D. Withhold the dose and notify the prescriber. Rationale. Digoxin doses are held, and the prescriber notified if the apical pulse is 60 beats per minute or lower or is higher than 100 beats per minute. The other options are incorrect. The patient receives enalapril, Vasotec, as treatment for heart failure. What is the best nursing assessment following the initial administration of this drug? 1. Assess the patient for ototoxicity. 2. Assess the patient's blood pressure. 3. Assess the patient for an irregular pulse. 4. Assess the patient for a serious rash. Correct answer. 2. Assess the patient's blood pressure. Rationale 1. Severe hypotension, known as first dose phenomenon, can occur after the initial administration of enalapril, Vasotec. Ototoxicity is an adverse effect of loop diuretics. Stevens-Johnson syndrome and irregular pulse are an adverse effect of beta blockers. The patient receives captopril, Capitan, as treatment for heart failure. Which adverse effect will the nurse plan to report to the physician? 1. The patient develops a cough. 2. The patient develops diarrhea. 3. The patient develops dehydration. 4. The patient develops facial flushing. Correct answer. 1. The patient develops a cough. Rationale. A cough is an adverse effect of captopril, Capitan, and should be reported to the physician. Other options are not an adverse effect of captopril, Capitan. The patient receives furosemide, Lasix, and digoxin, Lanoxin, together. Which laboratory findings will the nurse assess as increasing the patient's risk for digoxin, lanoxin, toxicity? 1. Hyponatremia and hyperkalemia. 2. Hypermagnesemia and hyponatremia. 3. Hypercalcemia and hyperkalemia. 4. Hypokalemia and hypocalcemia. Correct answer. 4. Hypokalemia and hypocalcemia. Rationale. Hypokalemia and hypocalcemia can result from an interaction with furosemide, Lasix, and digoxin, lanoxin. So it will increase a patient's risk for digoxin, lanoxin, toxicity. All other options do not result from an interaction with furosemide, Lasix, and digoxin, lanoxin. So it will not increase the patient's risk for digoxin, lanoxin, toxicity. Which individual listed below would be at the greatest risk for developing heart disease? 1. 35-year-old with diabetes mellitus and prehypertension. 2. 75-year-old with Parkinson's disease and normal blood pressure. 3. 52-year-old with osteoporosis and stage 1 hypertension. 4. 68-year-old with stage 2 hypertension and recent myocardial infarction. Correct answer. 4. 68-year-old with stage 2 hypertension and recent myocardial infarction. Rationale. 1. Cardiac tissue weakens as people age, and can be caused or accelerated by chronic hypertension. Myocardial infarction, diabetes mellitus, and other cardiac-related diseases. Age, race, and hypertension lead to an increased risk for developing hypertension. Race and smoking are risk factors, but being female and younger decreases the overall risk. Age and obesity are risk factors, but not as much as age, black race, and hypertension. Asthma, by itself, is not considered a significant risk factor in the development of heart failure. The patient receives digoxin, lanoxin. Which assessment findings would indicate adverse effects to this medication? 1. Tachycardia and hypotension. 2. Blurred vision and tachycardia. 3. Anorexia and nausea. 4. Anorexia and constipation. Correct answer. 3. Anorexia and nausea. Rationale. Anorexia and nausea are common adverse effects of digoxin, lanoxin. Hypotension can occur, but bradycardia occurs, not tachycardia. Blurred vision can occur, but bradycardia occurs, not tachycardia. Anorexia can occur, but diarrhea is more likely than constipation. The physician orders metoprolol, Toprol XL, for several patients. The nurse will hold the medication and contact the physician for which patient. 1. The patient with an apical pulse rate of 102. The patient with compensated heart failure. 3. The patient with chronic bronchitis. 4. The patient with a history of migraines. Correct answer. 3. The patient with chronic bronchitis. Rationale. Beta blockers are contraindicated for patients with chronic bronchitis. Beta blockers may be used for patients with migraines. Beta blockers may be used for patients with compensated heart failure. Beta blockers may be used for patients with apical pulse rates of 100. The patient will receive an IV infusion of milrinone, Primacor, as treatment for acute heart failure. What is the priority plan by the nurse? 1. Plan to monitor for atrial fibrillation. 2. Plan to monitor the ECG continuously. 3. Plan to take vital signs every 15 minutes. 4. Plan to monitor for hypertension. Correct answer. 2. Plan to monitor the ECG continuously. Rationale. The patient's ECG is usually monitored continuously during the infusion of milrinone, Primacor. Vital signs should be assessed continuously, not every 15 minutes, while the patient receives milrinone, Primacor. Hypotension, not hypertension, is an adverse effect of milrinone, Primacor. Ventricular dysrhythmias, not atrial fibrillation, are an adverse effect of milrinone, Primacor. The nurse teaches the patient about lisinopril, Prinaval, and evaluates that additional teaching is required when the patient makes which statement. 1. I will monitor my blood pressure until my next appointment. 2. I will avoid using salt substitutes for seasoning. 3. It takes a while for this medication to take effect. 4. I don't need to worry about having blood tests done. Correct answer. 4. I don't need to worry about having blood tests done. Rationale. The use of ACE inhibitors can lead to neutropenia, and the patient should be monitored for this side effect by having his absolute neutrophil count, ANC, measured. Potassium should be limited to avoid hyperkalemia. Blood pressure should be monitored to assess effectiveness of the medication. It takes a while for lisinopril, Prinaval, to become effective. The nurse teaches the patient about digoxin, Liley, toxicity, and determines that learning has occurred when the patient makes which statements. Select all that apply. 1. I should limit my fluids while taking this medication. 2. It is okay to keep taking my ginseng. 3. If I have nausea, it means I must stop the medication. 4. I can drink orange juice every morning. 5. I must check my pulse and not take the medication if it is less than 60. Correct answer. 4. I can drink orange juice every morning. 5. I must check my pulse and not take the medication if it is less than 60. Rationale. Orange juice is a source of potassium, which will minimize the risk for digoxin, Liley, toxicity. Nausea, by itself, may be a side effect, but it is not necessarily indicative of digoxin, Liley, toxicity. 60 beats per minute is the generally accepted limit for withholding digoxin, Liley. Ginseng may increase the risk of digoxin, Liley, toxicity. Dehydration can increase the risk for digoxin, Liley, toxicity. The patient must not limit fluids. The patient has hypertension and asks the nurse how this can lead to heart failure. What is the best response by the nurse? 1. Hypertension causes resistance in your blood vessels, or afterload. Your heart works harder and weakens. 2. Hypertension limits the ability of your heart to stretch before emptying, or afterload. Your heart works harder and weakens. 3. Hypertension causes resistance in your aorta, or afterload. Your heart works harder and weakens. 4. Hypertension limits the amount of blood entering your left ventricle, or afterload. Your heart works harder and weakens. Correct answer. 1. Hypertension causes resistance in your blood vessels, or afterload. Your heart works harder and weakens. Rationale 1. The most common cause of increased afterload is an increase in peripheral resistance due to hypertension. Afterload refers to peripheral resistance, not to the amount of blood entering the left ventricle. The ability of the heart to stretch before entering is known as preload, not afterload. Afterload refers to peripheral resistance, not to resistance in the aorta. The nurse is caring for a patient being treated pharmacologically for heart failure. Which laboratory values is the nurse careful to monitor during treatment? Select all that apply. 1. Potassium levels 2. BUN 3. Creatinine 4. Liver function tests 5. Serum drug levels. Correct answer. 1. Potassium levels 2. BUN 3. Creatinine 5. Serum drug levels. Rationale. It is important to monitor electrolyte levels, especially potassium, renal function, and serum drug levels. When a patient is being treated pharmacologically for heart failure, it is not necessary to monitor liver function while a patient is being treated pharmacologically for heart failure. The nurse is caring for a patient who is being treated pharmacologically for the symptoms of heart failure. What would be included in the nurse's role of pharmacologic management of this patient? Select all that apply. 1. Teaching the patient how to space medications to decrease adverse effects. 2. Teaching the patient the long-term benefits of beta blockers. 3. Continually monitoring the patient during IV infusions. 4. Decreasing medication dosages when the patient complains of adverse effects. 5. Changing a medication that is no longer working to decrease the patient's symptoms. Correct answer. 1. Teaching the patient how to space medications to decrease adverse effects. 2. Teaching the patient that long-term benefits of beta blockers. 3. Continually monitoring the patient during IV infusions. Rationale. 1. Role of the nurse is patient teaching. The nurse should teach the patient how to space medications to decrease the hypotensive effects that can occur during treatment for heart failure. Beta blockers can have many adverse effects that can affect adherence. The nurse should teach the patient the long-term benefits in order to increase medication adherence. Patients who are receiving medications used to treat heart failure by IV require continual monitoring by the nurse. The nurse cannot change a dose of a medication without a healthcare provider's order. This is outside the nurse's scope of practice. The nurse cannot prescribe medications. It is outside the nurse's scope of practice to change a medication with a healthcare provider's order. The nurse is caring for a patient who has been diagnosed with heart failure. The nurse knows that which conditions may have contributed to the development of heart failure in this patient. Select all that apply. 1. Uncontrolled hypertension. 2. Coronary artery disease. 3. Diabetes. 4. HIV. 5. Mitral stenosis. Correct answer. 1. Uncontrolled hypertension. 3. Diabetes. 2. Coronary artery disease. 5. Mitral stenosis. Rationale. Uncontrolled hypertension, coronary artery disease, diabetes, mitral stenosis are associated with the development of heart failure. HIV is not associated with the development of heart failure. The nurse is concerned that a patient is developing right heart failure. What did the nurse assess in this patient? Select all that apply. 1. Ankle edema. 2. Enlarged liver. 3. Displaced apical heart rate. 4. Shortness of breath. 5. Cough. Correct answer. 1. Ankle edema. 2. Enlarged liver. 3. Displaced apical heart rate. Rationale. In right heart failure, the blood backs up into veins, resulting in peripheral edema. Engorgement of organs such as the liver. A displaced apical heart rate would indicate cardiac hypertrophy, which is associated with right heart failure. Shortness of breath and cough are a manifestation of left heart failure. Which of the following is the most serious adverse effect associated with milrinone, Primacor? 1. Ventricular dysrhythmia. 2. Nausea. 3. Headache. 4. Atrial dysrhythmia. Correct answer. 1. Ventricular dysrhythmia. Rationale. 1. Milrinone is a phosphodiesterase inhibitor that can cause ventricular dysrhythmias. Atrial dysrhythmias can occur, but ventricular dysrhythmias are more serious. Headache and nausea also can occur, but are not as serious as ventricular dysrhythmias. Which vital sign is of greatest concern to the nurse prior to administering digoxin, lanoxin? 1. Heart rate. 2. Temperature. 3. Blood pressure. 4. Respiratory rate. Correct answer. 1. Heart rate. Rationale. An apical pulse should be checked for 1 full minute prior to administering digoxin. If the heart rate is low, generally 60 bpm, the medication should be held and the ordering practitioner informed. Digoxin can suppress electrical activity within the heart and lower heart rate. Which statement is accurate regarding the use of beta-adrenergic blockers for use in patients with heart failure? 1. Higher doses are used initially until optimal vital signs are achieved. 2. Dosage changes are done on a daily basis for the first 2 weeks. 3. This drug class does not have an effect on the bronchioles of the lungs. 4. They are generally used in combination with other heart failure drugs. Correct answer. 4. They are generally used in combination with other heart failure drugs. Rationale. Beta-adrenergic blockers are rarely used to treat heart failure alone. They are commonly used in combination with ACE inhibitors. Initial doses are small, and are doubled every 2 weeks until the optimal dose is achieved. Beta-adrenergic blockers can be selective to beta-1 receptors or non-selective. Non-selective blockers block beta-1 and beta-2 receptors. The blockage of beta-2 receptors can affect the bronchioles of the lungs. Lisinopril, Prinaval, is often used to treat heart failure because it lowers blood volume. Which of the following best explains how lisinopril lowers blood volume? 1. It has an antagonistic effect on angiotensin-converting enzyme. 2. It lowers aldosterone secretion, a hormone that increases sodium reabsorption. 3. It causes hypernatremia and increased renal tubule permeability, resulting in a diuretic effect. 4. It causes a diuretic effect by lowering the amount of sodium lost in the urine. Correct answer. 2. It lowers aldosterone secretion, a hormone that increases sodium reabsorption. Rationale. ACE inhibitors lower blood volume by lowering the secretion of aldosterone from the adrenal cortex. Aldosterone is a hormone that increases the reabsorption of sodium and water. ACE inhibitors have an antagonistic effect on angiotensin-converting enzyme, but this action lowers blood pressure by reducing peripheral vascular resistance, not by lowering blood volume. Increasing sodium in the blood will not lower blood volume. Which of the following medications would be of most help to increase myocardial contractility in a patient with heart failure? 1. Digoxin, lanoxin. 2. Lisinopril, Prinaval. 3. Carvedilol, Corig. 4. Furosemide, Lasix. Correct answer. 1. Digoxin, lanoxin. Rationale. 1. Cardiac glycosides, digoxin, increase cardiac output by increasing the force of contraction. Diuretics, furosemide, lower blood volume. Beta blockers, carvedilol, lower heart rate, and ACE inhibitors, lisinopril, lower peripheral vascular resistance and blood volume.